The sucrose addition in childhood does increase the risk of obesity and overweight as per the studies done by May et al. So what are the potential dangers of starting sucrose in the first 6 months of life? It's early childhood carries. Obesity and overweight is a problem. Obesity and weight increases the risk of hypertension and diabetes. Children can have behavioral problems. The question is, can you use these sugars in infant formulas? And the answer is no. And it is not the preferred sugar for milk. Lot of adult diseases have onset in childhood. The seeds of the disease are laid foundation in the childhood. Second is it's a fermentable sugar, so acid is produced. The third is bacterial overgrowth. Early exposure to sucrose will lead to taste preferences. Starting sucrose early on life will lead to micronutrient deficiencies, which can lead to various disease manifestations when they are a little bit older. Sucrose does affect children's growth. If a child consumes a lot of sucrose in the early years of life, will have better growth in the first 4 to 6 years of life, but subsequently between 7 and 9 years, their growth will falter. So early on, children will probably look chubby, which parents think that they are doing well, but they will suffer growth problems between 7 and 9 years, and also they will suffer micronutrient deficiencies. Promote exclusive breastfeeding in the first 6 months to avoid added sugars and starches, and also ensure adequate micronutrient intake, and teach the child to consume as much as they need rather than pushing to make sure that the plate is empty. We should avoid sucrose in all infant formulas given to children under the age of 6 months, because we know that human milk does not contain sucrose but contains lactose as the prime sugar. Nature is the best gift, and we knew from the beginning that breast milk is the best milk, and definitely we know that lactose is better than sucrose, so we should be avoiding sucrose for all our children so that they have a healthier future.